When it comes to getting antiviral drugs for COVID-19, these two cancer patients had a very different experience.
The COVID doctor rang. He said, "We think we should put you on the antivirals because of my past medical history." They arrived in my letterbox at about 7 p.m.
Correct, yeah.
It was a different story for Liz Pickworth, who tried to get the medication earlier this year.
I felt a little bit alone and I didn't know where to look for information. I didn't know who to contact.
And despite repeated calls to COVID hotlines, she wasn't able to get the drugs she was eligible for.
I was receiving phone calls a couple of times a day, making sure that I'm still okay. What would have really helped me was having the antivirals.
Delays in accessing the drugs have prompted the Pharmacy Guild to call for antivirals to be sold over the counter.
What we would like is we would like Australians that satisfy the criteria to not have to go to their doctor to get a prescription. We would like them to be able to just present to their pharmacy and the antiviral can be provided.
Antivirals are most effective taken in the first few days after testing positive. The Guild says many people can't get in to see a doctor quickly enough. But doctors' groups say after a shaky start, the system is now working well.
We've seen a really positive increase in the number of prescriptions being dispensed over the past couple of weeks in particular.
More than 180,000 scripts have been written for antivirals up until July this year. But so far there's no indication if or when they'll be available for a broader population. Despite not getting antivirals, Liz made a full recovery. Jan says for her, the drugs were critical.
I think I'd have been in strife without them, I really do.
She too made a full recovery. Sophie Scott, ABC News.